vaccines can you offer her if she has not received?
I think, sir, all vaccines can be offered during the period of lactation. Apart from that, we can offer the HPV vaccines during that
HPV
period
is one,
also, sir.
yes. Anything which cannot be given, which actually is not used in our country
Yellow
regularly,
fever,
except
yes.
for the yellow fever,
Yellow
everything
fever,
can
yes.
be given, but we don't use it routinely. So we should utilize the opportunity of the child coming to you during lactation, the newborn. We should tell them that please do catch up with your remaining vaccinations. So now the child grows a little up, and as I was saying, childhood vaccination can take a full day. So I thought, let's ask just one question. There's an 8-year-old child who has come, who is unvaccinated and comes to you for vaccination because now the school needs a chart. What will you do? Dr. Aradhana, I think you should answer this.
Thank you, sir. So you have already specified the child is 8 years old, and another thing is child is unvaccinated. So for any illness, just like any illness, for vaccination also we need to take a quick history. Without history, we need not proceed. So first thing is you confirm the age of the child, exact age from the date of birth of the child. We need to know the vaccination records. Here we have already specified that the child is unvaccinated. Otherwise also we need to confirm what all the vaccines the child has received, and documented evidence is to be taken into account. If there is no documentation, it is better to assume the child as unvaccinated. Then we need to know what is there a history of chronic illness in the child to know the risk factors, because it modifies the vaccination protocol in the children. Then has the child developed any other allergies? Since the child has not received any vaccine, so we may not know about adverse events following any vaccination. Then we need to know, are there any parental concerns or family concerns regarding vaccination? Has the child previously suffered from measles, mumps, hepatitis A and varicella? Here we need to know that all these illnesses, we do not take into account what parents are. If it is physician confirmed and laboratory evidence is there, then we confirm that, okay, the child has suffered from these illnesses. Then we should know what all the vaccines the child needs to get. Since the child is unvaccinated, so we need to know what is the catch-up schedule for this child. So we should follow certain key principles, out of which some important ones I am telling. So the first one is to know the eligibility for each vaccine, for which we need to know what is the minimum age, maximum age, as well as the time interval between the two vaccines for any vaccine. Then we should also know that it is very safe, and we should tell parents also that it is safe to give multiple vaccines at the same setting. Rather, we should try to give as many vaccines as possible in the first visit only, because this child is unvaccinated. So there are high chances that the child may not return in the next visit also. So it is quite safe. And another thing is also, there is no fixed protocol for any catch-up vaccination. It is individualized depending upon the child's age, the child's high-risk status for any vaccination, or the child is having any chronic illnesses, and also parental concerns and parental affordability also. So this is a very beautiful IAP chart. Here, the green zone is showing us the catch-up schedule. So for this child, we see that the child will receive hepatitis B vaccine, 3 doses, 0, 1 and 6. Then DTP antigen-containing vaccine. So the first dose will be Tdap, as the child is more than 7 years old. And the rest 2 doses will be TD vaccines. The child will receive MMR, 2 doses 4 weeks apart. And typhoid conjugate vaccine, single dose. Hepatitis A vaccine, if inactivated, 2 doses. Or if live vaccine, 1 dose. And varicella vaccine, 2 doses, 3 months apart. So it is very important to give the parents a fixed schedule or all the visits, to tell them in the first visit only that the child needs all these vaccinations, and tell them that they should come in these visits and try to get, this is just a prototype of catch-up vaccination. Anyways, it will be individualized depending upon the child's age and parental affordability also.
Yeah, so in summary, just take a history, make a chart, and accordingly adjust. If the child has already had varicella, you can exclude. But make a history, make a chart, what all vaccines are required, and then move on with the next. Actually the clock shows how many? 7-8 minutes left. It was 9 to 9:45 our timings, and we started late. So the clock has to be adjusted. So Dr. Radhanav, continuing, I think we'll have to move a little faster. Now an 18-year-old comes to you because the child is joining college, and the child, which all vaccines do you think will be a must for him to join college before that?
So here we are talking about adolescent vaccination. Just quickly, these are broad categories. If the child has not received these vaccines, MMR, varicella, typhoid, hepatitis, during childhood, we need to catch up these vaccinations even at this age. So these are 5-6 catch-up vaccines. Then there are certain adolescent-specific vaccination, like Tdap is given 2 doses at 10 years and 16 years. If this child has not received, we should give at least 1 dose. Then HPV vaccine, although the child is boy, even then HPV vaccine should be given. Since the child is more than 15 years of age, so 3 doses are recommended as 0, 2 and 6 months. Then if the child is having, this adolescent is high risk, then we should give all these vaccines. Now the important thing here is that the child is going to college. Adolescent is going to college. So he may go to live in hostels also. So he may be predisposed to overcrowded conditions. So meningococcal vaccine is very important here, as this disease is very infectious and is known to have, outbreaks are known to occur in hostels. So meningococcal vaccine will be advised, especially for this.
Yeah, so in short, I think
Adolescent.
all vaccines are important.
All
we
are
can't
important,
say
yes.
that this is not important. Catch up, whatever is left, we should complete and then send the child to the hostel. Okay, then moving on to early and adulthood. These are not geriatric patients, these are young adults. They come to a clinic and they see a poster outside a clinic which says that even adults need vaccination. They are interested in protecting themselves. How will you counsel them? Dr. Bhaskar, I think we should.
Pediatricians are seen as a primary vaccine provider in the society, and even adults approach sometimes pediatrician for their counseling vaccination. The counseling has to be done appropriately. There may be different variety of patients. One who have not received any vaccination, now they want to receive some vaccination. Those who want to know about the new vaccines which have come up and they want to now get themselves vaccinated. So they have to be told that vaccines are important for protection against diseases, and even if they have previously received some vaccines efficacy wanes off over time and they need to get boosters for some of the vaccines. Then there are vaccines like influenza, in which antigenic drift and shift mechanisms are there and for which yearly and vaccines are required. What works best in the counseling of these patients are that some adults do say that we are healthy, till now nothing has happened to us, so why do we need to get vaccinated? You counsel them that you may be very healthy person, but there are susceptible individuals at your home, elderly males, elderly people, and the neonate, the sick patients who have more vulnerability to acquire infection. So you need to be protected to protect those individuals. Then there are different guidelines. WHO has its own guideline, then Journal of Association of Physicians of India, API, gives their guideline. So these are the vaccines which are recommended for almost all of the individuals. They must receive. All adults should get DPT. Adulthood, they should get Tdap or TD, whichever is available. Then MMR is indicated. If they are previously vaccinated and non-vaccinated, there are separate category. If they are non-immunized, even a single dose will work. Influenza has to be given yearly. Then PCV is recommended for elderly, those who are above 65. HPV vaccine, Ceravac is up to 26 years, it is validated, but otherwise it is recommended that you can get it 15 to 45 years. One concern is that if the person is sexually active, whether they need to get, you need to counsel them that the vaccine may not have very good efficacy in those if they are already have prior exposure, but still something is better than nothing, they can still get. Then zoster is recommended for elderly people. These are the vaccines recommended in a special situation where hepatitis B, hepatitis A, meningococcal, H influenza B, if the person is immunocompromised, then or working in a setting like healthcare workers need to get hepatitis B vaccine. So this is in summary. In healthy individuals, you must counsel them to get at least Tdap, MMR, influenza, pneumococcal, HPV, and zoster vaccine in elderly. But a high-risk individual should get these vaccines, but this is as per API. But if somebody asks my personal opinion, I would say hepatitis B, each individual should get hepatitis B because you never know when you will need a blood transfusion, and hepatitis B has occurred in most unusual circumstances. People getting tattoos, people getting it from barber shops. So hepatitis B, they need to be vaccinated.
No, definitely hepatitis B has to be included. It's not high risk. So then the child has now grown even further. We have an adult physician with us. He'll be telling us about geriatric vaccination. Why is it important?
So I think thank you, Dr. Wadhwa, for inviting us for very interesting vaccination, and thank you, API, for including adult vaccination and elderly, right? So now, what is elderly population? Okay, we have talked about adults. So as a consensus, elderly is more than 6 years of age, the legal age of being elderly. So now there are super agers also, like patients who are 80 plus. Now you know that in India, the longevity is increasing, life expectancy is increasing. So census held at 2011, it said that 10.8%, around 100 millions were elderly, more than 60 years of age. Now it has been projected that in 2031, this number would go to almost 200 millions, the double, right? So it would actually add on the healthcare burden of the society, particularly as our country is concerned, right? So this is the important, why geriatric vaccination is important. We all know the age-related decline, which is known as immunosenescence, because the immunity declines at age, and all the vaccines which are recommended now in elderly is more than 50 years of age, where actually we don't have any much immunity left. Then higher risk of severe infections and complications we have seen in COVID. So now people are talking about adult vaccinations. Pre-COVID we don't talk about it, and there's no national guidelines as well. But post-COVID now people are asking that, okay, I need some vaccination. Then multiple comorbidities, for example, patient having diabetes, patient having COPD, they are higher risk of getting infections, though they are more